evening, everyone. I am Dr. Nupur Gupta, practicing gynecology in Gurgaon for last more than 2 decades from Well Women Clinic, and also I work as director in the Department of Obstetrics and Gynecology at Fortis Memorial Research Institute, Gurugram. One of my passion is also to look after PCOS women, and I am also the founder of PCOS Clinic. Our aim is not only to look after their physical well-being but also mental health of all the PCOS warriors. As we know from research that people with PCOS are 3 times more likely to experience depression and anxiety than people without PCOS. Emotional problems like anxiety, depression are common and are often overlooked and therefore left untreated. So, to address this concern, we have with us today Mrs. Shivani Jain. She is a clinical psychologist based out of Delhi, and she is with us to find out solutions regarding the same. So, welcome, Shivani ji.
Thank you, Dr. Nupur. I'm glad to be here on this platform to be able to discuss on such an important aspect of health, especially related to PCOS.
Yeah, thank you. Major research has been done till now on physical symptoms, and little attention has been paid to the emotional health. And almost 57% of women with PCOS have been reported to have at least one mental disorder, whether it is depression, anxiety, or maybe social anxiety. We know that a healthy mental state is fundamental to good health and overall quality of life. For women with PCOS and side effects like obesity, acne, excessive hair growth, infertility, low self-esteem, and so many, the line continues. To having made a diagnosis of chronic disease is in itself a risk factor for depression. In addition, they are also at a heightened risk for eating disorders. So Shivani, so let us discuss that how can we address those concerns. So in your practice, what have you seen as mental health aspects associated with PCOS when it is diagnosed in adolescent girls and reproductive age group, whatever may be the age?
In adolescent girls and other women in the reproductive age, I think reactions to the diagnosis, that is a very important part to look at when we are talking about mental health, because when one is diagnosed with such a disorder, it leads to a range of emotions, such as fear, such as anxiety, uncertainty, and anger, aggression, and one is not able to understand how to deal with it. And not only the individual's reactions, I think what I have seen in my practice that the reactions of the family members or the reactions of the relatives add to the pain. So a lot of emotional turmoil, I would say, begins from that point of time, leading to a lot of stress. And if the individual, if the person is not able to handle those emotions and it continues over a period of time, it can lead to very severe mental health issues. And it has been shown by research that a huge percentage of women are experiencing anxiety and as well as depression. Mental health aspects are very important to be dealt with because it will interfere with the person's ability to follow the medical guidelines. It will also interfere with the woman's ability to look after herself. And as we know, PCOS is a disorder where lifestyle changes may play a huge role. So when we have a low emotional health or when one's mental health is impacted, I think the commitment towards following the treatment will also be affected very, very adversely. Here, I would also add that in India, in our culture, we don't understand much about emotional health. We do understand about the physical health, we do understand about the medical complications, and we do seek medical advice and we do go for the medication. But when it comes to emotional health, we are not very alert to the indicators that one is not feeling emotionally healthy or where one needs to seek professional advice. And emotional health is not only feeling happy all the time, it is more about being able to handle your emotions, being able to be aware of your own thoughts, limit your self-defeating thoughts, and have a positive image about yourself and reaching out to and relating to other people well. So I would say that yes, this is a very important area to focus upon, as equally important as the physical health.
Yes, Shivani, we have also seen in our clinical practice that physical aspect is one thing, but if they are emotionally disturbed, even compliance to treatment gets altered. But yes, there are various kind of people who react to this. There are also some who have a very good acceptance and they are determined to fight it over. Whereas at the same time, there are some who become very aggressive and irritable in their behavior, and it becomes a day-to-day problem also for them. So we come to the next part of it, that does it also affect their sleep pattern?
Yes, absolutely. It affects the sleep patterns hugely because of the emotions that I'm experiencing. It's adding to a lot of mental stress, and I'm not able to sleep well. And it's like a vicious circle. When my sleep pattern gets affected, I will experience more of mood swings. And I will, lose my emotional control more often in more situations. And for example, a person could be more reactive towards family members around and not be able to decide with a very cool and calm mind. So, sleep patterns getting disrupted will lead to a whole lot of other adjustment issues.
Yeah. So yes, sleep is a very important part of our health. And if inadequate sleep sometimes also leads to emotional eating, exertion, irritability, mood swings, and even your work efficiency, whether she's an adolescent girl in school or whether in reproductive age group, sleep can have a hazardous effect on health overall, if you talk about. Next, we come to the body image issues that they face, which can be related to so many other areas of their life. Like even in school, they get impacted, or whenever, if they are working at some place in the workplace environment, they have issues related to this, and also indirectly it affects their personality also. So, what would you like to say about this?
So, body image is another very important aspect, and body image is the way, I would say, it's the way a person thinks and feels about his or her body. So, in this case, when a woman is diagnosed with PCOS and the physical symptoms that you're experiencing in terms of acne, hair loss, weight gain, and looking at it in the context of our culture, where we think that girls should be physically attractive, and getting married is an issue, is an important issue for the family. So it leads to a whole lot of pressure on the young girls, especially who are going through these physical symptoms, that they start feeling very unattractive about themselves. They start feeling very low about their body. And when one doesn't value, when you don't value your body, it leads to low self esteem. Then you don't value yourself, especially in the case of young girls, and they experience a lot of body shaming. Their peers and relatives sometimes unmindfully can tell things, or say remarks, or throw remarks on their physical appearance, which is very hurtful for them. And so it's very important over here to seek help, and not let low body image really damage your confidence, and it can affect all spheres of your life.
And yes, the issues are related to being overweight, not able to lose weight, sometimes
Yes.
a lot of acne, which is on face, and uh, treatment also will not immediately solve that problem. Sometimes excessive hair growth, and so many other problems. And so, do you think all these issues can also lead to relationship problems in their life?
These issues definitely relate to relationship aspects, because when one is experiencing low self esteem, when your body image is poor or weakened, then you withdraw. Then you don't feel confident enough. You're not able to relate well to others, and you don't want to face social situations. So there is a lot of social withdrawal. At the same time, what I have also seen in young girls, their family members are not able to understand about the emotions that they're going through. They can become very reactive. They can become very, aggressive and very difficult to handle. So it impacts your relationships because it impacts your behavior. So the way you are feeling from inside is definitely manifested in the way you behave in your day-to-day life situations. And relationships, not only at home, but at the work, you feel less confident, you don't want to face the world. And also in terms of relating to the opposite sex, like, for adolescent girls, it's important to be having friends, and they're not able, very comfortable with peers because they're very conscious of their physical appearance. So it hugely impacts their social life.
Yeah, and sometimes because of PCOS, there is hair fall, even so they feel ashamed about this. And
Yes.
because of excessive hair growth on the face, which is the most affected, they feel the loss of femininity is also a big issue. And for women who are in reproductive age group, sometimes they face sexual health problems as well, leading to poor sex drive or not in a mood to go out with your partner or with your family, and they want to be to themselves only. So as far as these issues are concerned, Shivani, do you think that counseling will help them in any way?
Counseling is definitely something, a process which I would say provides them an opportunity to, get a confidential space, an emotionally safe space where they can talk out their fears and where they can talk about their troubled feelings, and which is itself very therapeutic, because the emotional release by talking out your feelings, what you're
Yeah,
experiencing, that itself helps you a lot, gives you a lot of strength to deal with the pain, I would say. So I
yeah,
would definitely feel that counseling will play a very, very important role here. And in terms of guiding the person to take care of his or her, to take care of her emotional health, because emotional health is something they need to continue to work upon by doing things which give them joy, by following a good lifestyle, by using techniques to enhance sleep, by using certain strategies to feel more relaxed, and develop, most importantly, counseling can help them to develop a positive self concept. So then they don't give up. Then they are ready to fight it out. Then they are ready to comply with the treatment. And they
yeah.
believe that, yes, they can deal with it. And this is something I feel will really, really affect the prognosis, or how well the disorder
They
is
will take
treated.
it up. Yeah, yeah. Uh-huh. And we also encourage that the family should be counseled. If she's an adolescent girl, then the parents, and if she's married in reproductive age group, then maybe the partner, because that will help her take this forward. And it is very important to also destigmatize this name, because the name itself uh, brings lot of fear and denial in their lives. So yes, you are right that doing things that make them feel good
Yes,
will be very helpful, and counseling will also improve our compliance to treatment. So
yes,
if we,
absolutely.
so Shivani, yes. So if we look at the data, what the data shows about the mental health aspects, so I would like to share this, that almost 14% of women, research says, suffer from depression, 22% from almost 42% from anxiety, 13% from binge eating disorder, and 12% from disordered eating. But imagine the brunt of a poor body image, which was almost 99.9%, which is a quite a big number. So I think lot of focus needs to be given to this as well. So we come to the next point, that how do they know that they have anxiety as an issue in their life when this happens?
So, when one is undergoing a lot of stress due to the feelings that the diagnosis generates, and as I shared earlier, it's not only your own feelings, but it's also the reactions and the feelings of others in the family, in the social
Yes, yeah.
circle. And how it depends on how much professional help or guidance and support you're able to get. But if you experience a lot of stress, helplessness, hopelessness over a period of time, it can really lead to mental health issues such as depression and anxiety. Anxiety, I would say, is characterized by a state of panic, where you're always worried or concerned about something bad to happen, wi-
Yeah.
due to which you cannot focus on anything. The mind is so clouded with thoughts, and you always feel threatened about things. You are wanting to play safe. Your mind is not free. So I would say here, the major areas of your life can get affected, such as relationships, such as your work, or your day-to-day things, like even your day-to-day activities, eating, your diet, and sleep patterns. Sometimes people can eat very excessively when they are anxious. So these are some of the indicators that
Yes.
tell.
So yes, it is a large group of women, as we just saw that 42% can face anxiety issues when this diagnosis is made. So we come to the next common emotional health issue related to this, that is depression. So how do they know that they are undergoing depression and they should seek medical help?
So depression, though, first of all, I would say that we use this word very casually, that I'm feeling depressed. So once in a while, anybody can feel low, or sometimes we are not in that enthusiastic mood. We all go through those ups and downs in life, and we can feel low. But when that low feeling persists over a period of time and gets very severe, and it is characterized by a very weak sense of self, very low thoughts, and very lot of pessimism, and not wanting to do anything, lack of interest in those activities that I used to enjoy earlier. These are very clear indicators of that. Yes, I may be experiencing depression, but
Depression, yeah.
one should not come to a conclusion, themselves. It's again to be diagnosed
Yeah.
through professional help, and then proper treatment and proper therapy to be taken to deal with it. And sometimes it may require medication as well.
Yes. We just talked about that how common is depression and how they are feeling, and there is another study that states that women who have PCOS are 3 times more likely to suffer from depression, and other contributing factors are hormone imbalance, their altered brain chemistry, and also the symptoms which happen due to PCOD are a contributing factor and affecting almost their relationship with society, and that is how it impacts their health. So this is from another research article which shows similar findings. So Shivani, we next come to that many a times they are advised to follow mindfulness in their life. So how do you think it can help?
Mindfulness is a very effective strategy, and there is research to substantiate that it helps to release your stress. It helps to have better control over your emotions, and through a range of mindfulness practices, whether it's about deep muscle relaxation, body scan, focusing on your breathing, or color meditation. There are so many different forms of mindfulness exercises available to us. We need to look at the one which really works for us, and over a period of time it can definitely build our capacity to deal with the pain or deal with the stress that I'm going through. So
Yeah.
that is a very important strategy, or very important element to be built in our lifestyle.
Yeah, and sometimes I think when we are practicing mindfulness for which whatever may be the reason, very important is also to practice mindful eating. And sometimes in day-to-day life we also forget that and go for binge eating. But yes, this is very important part of life. So Shivani, how about music therapy or art therapy?
So, yes, these are very creative therapeutic approaches. And in most of the times, like with my clients, I would use a combination of therapies where, cognitive behavioral therapy, we will talk about it later, and along with some mindfulness exercises, and art therapy and music therapy together, I think can create a lot of impact. And art therapy is a creative form of therapy which helps to bring out your inner emotions. It helps to deal with troubled emotions. I think in the case of young girls, this could be one of the very effective
Yeah,
therapeutic
yeah,
approaches.
especially school-going girls, you mean.
School-going
Yeah.
girls, and for for women in the reproductive age, music therapy is a great therapeutic approach, and it has found to be very effective, especially in calming your mind down and helping you to think more clearly.
Yeah, yeah. So Shivani, a lot of times it is also talked about that cognitive behavioral therapy really helps. Uh, so how does this work?
So, cognitive behavioral therapy is a therapeutic approach which is found to be very effective in dealing with depression and anxiety. It is based on the principle that the perception of the problem, the situation does not impact us that much, but the perception of that situation, the way we think about that situation, is what affects us. So, here in this therapy, we will deal more with the thoughts that a client is having. So if a person, let's say, is diagnosed with PCOS and you're having fears, you are having, which could be based on irrational beliefs, which could be based on certain myths. So we challenge those beliefs. We help the person to challenge their own thoughts and then develop more helpful thought patterns, to be able to develop thought patterns which help them to think more clearly, more rationally, and to be able to take more constructive steps towards what can be done. So it's more about, CBT is more about working on the thought patterns.
Okay. So if we are able to change our deep-rooted thoughts, it will
Yes,
really be helpful.
absolutely.
Yeah, and we can make better choices for our own health.
Yes, sure.
Okay. So Shivani, what would you like to tell the audience and or to girls and women with PCOS? When is it the time that they should go and visit a clinical psychologist? So
So
how do they take this decision?
So, as a woman or as a girl who's been diagnosed with this disorder and all sort of thoughts coming into the mind about, the physical symptoms of the disorder or what will happen in the future, fertility related issues, or my body image.
Yeah.
So we experience a lot of emotions, and we as human beings have the resilience. We have the capacity to deal with those emotions. So, with professional support, with guidance from the doctor and family support, we are sometimes able to, gather the courage to deal with it and manage and be compliant towards the treatment. But in some of the cases, when these emotions get the better of us and I am not able to deal with it, and I have continued thoughts of hopelessness. And if you're feeling total lack of interest in activities you used to really relish earlier, and which is affecting your daily life activities, such as even going for a bath or doing your daily life activities is becoming a huge task for you. I would say these are indicators where one needs to be alert that yes, I need professional help before it becomes too severe. So, thoughts of self harm, thoughts of continued thoughts of pessimism, or you're experiencing panic and you're not able to focus on anything, and you're having very low thoughts about yourself, which is impacting your eating, which is impacting your sleeping patterns. So, that is where definitely one should
Yeah.
seek professional help so that it doesn't get worse.
And even the work efficiency goes down, whether it is study or whether it is workplace, that gets
Absolutely.
altered. So thank you so much, Shivani, for discussing so many of these problems in detail and your valuable and giving your valuable time for this session. So I would like to end by saying that be in charge, be gentle, and be honest with yourself. Even if PCOS is a part of you, empower yourself, and your PCOS can be improved if you have the right education, the right support by clinical psychologists, and you are willing to take the treatment at the right time and not to just ignore that yes things will go fine and take the right judgment at the right time and follow the advice which has been given to you. Although we are not saying that this is curable, but yes, we can help to a large extent, and even living with PCOS can be a joy. So you don't have to suffer from all these problems when the support is just right there. So to connect with Shivani, you can see in the description. I have shared her email. She is more than willing. I think we will also add her mobile number. You can connect to her
Sure.
whenever required for any issue other than even PCOS. So thank
Thank
you so
you.
much for patient listening.
Thank you.
Thanks.